This is Talk Business and Politics with Roby Brock.
Well, in late August, there was a strategic alliance announced between UAMS and Baptist Health. I am here with the leaders of those two organizations, Stephanie Gardner, who's the interim chancellor at UAMS, Troy Wells, who is the CEO at Baptist Health. Thanks to both of y'all for being here.
Thanks for having us.
All right, Stephanie, I'm coming to you first for this. Troy, you second for this. Define this strategic alliance in your own words.
This is really an opportunity for us to work together in a larger way than we already have. We've been partners for over 2 decades and providing clinical services, UAMS physicians, and the Baptist Health facilities. But now we're looking at ways to partner in larger ways through our educational programs, clinical partnerships, and also as we look forward to population health strategies.
Yeah, Troy.
Well, the partnership essentially had already begun. This was a way to kind of formalize it. We started working together over the course of several years, more and more, building on the things Stephanie mentioned, and it got to a point where formalizing it in an alliance that we could talk about openly with our employees, physicians, and other stakeholders was really important for us to continue doing more and more work together.
I get both of you on this one too. Is this more about feeding the workforce of the future? Is this more about keeping that pipeline of allied health employees as well as physicians moving?
That's one of the 3 key elements of the alliance is around education and the future workforce in Arkansas, whether it be nursing students between as part of this educational consortium that was mentioned in the statement, as well as our graduate medical education for physician residents in North Little Rock that will be starting in the year or so. So that's a big part of the alliance.
Yeah, Stephanie.
Yeah, I feel like the support for the creation of more physicians for the state of Arkansas is one of the most important parts of this partnership. Through the development of a joint initiative to start a graduate medical education program at the North Little Rock Baptist facility for its base, we should be able to have over 100 to 120 new physician residency spots created over the next decade.
Is any of it about you guys not competing against each other in terms of services? I mean, and I guess maybe you do something better than you do something better than they do.
Yeah, I wish they'd just stop competing with us. That makes things a whole lot easier. No, it is interesting because we are competitors, and we always have been, yet at the same time, what brought us together was kind of a grander vision of how we can work together and do more good. Both of our institutions are rooted in serving Arkansas, and so that's number one for us. And if we can do that better together, that's good for both institutions and good for the state.
No financial ties in this alliance, but somehow it saves you both money. You're gonna have to explain that one to me.
We do believe that we will be able to provide care more efficiently by working together than working separately. We're still going to stay true to our own unique missions, but I think by the specialty care that we provide, partnered with a very rich base of primary care through the Baptist system, working together looking for ways to do things more efficiently, we should be able to ultimately provide care better.
There's also some ways we'll have financial alignment. The Medicare Accountable Care Organization that we've entered into together does certainly provide financial alignment opportunities for us.
Is this big long acronym,
Yes.
PASSE?
No,
That's
a different
Yeah,
one.
that's a
All
different
right,
one.
okay, we'll come back to that a little bit. How much of this is Affordable Care Act driven in terms of finding ways to do this partnership in a bigger, better way? Is it forced you guys to do this, or do you think market forces were going to require this anyway?
Well, healthcare financing is changing, and as we look forward, we need to be able to create ways to have risk, but at the same time look for shared savings. And so we will ultimately, we believe, have a more efficient process.
I think the Accountable Care Act enabled some of the things that we're doing together, but didn't necessarily create the need for it. I think some of this was going to happen either way. You know, sharing the clinical services in a state like Arkansas, where we have opportunities, is a good thing with or without the Accountable Care Act.
You guys have both, I'm sure, watched with bated breath what's been going on in Washington, D.C. for the last several months. We seem to be, I guess, back to this process of the normal process of the Senate's going to go through and try to make changes to the Affordable Care Act after, I think, 3 attempts to push a GOP-led only initiative there for healthcare reform. What do you think needs to happen at this point in time from a federal level?
I think some stability. some certainty at some level that enables us to move forward with plans that we want to execute.
You just want to know what the rules are.
Just tell us the rules.
Yeah.
Yeah.
You feel the same way?
I feel the same way. I feel the same way.
All right. Tell me a little bit about the provider-owned Arkansas Shared Savings Entity, Arkansas Advanced Care. There's an opportunity to do more here, and I'm not really good with acronyms. Is it PASS, PASSE?
It's PASS.
Because I can go away with that. So,
Yeah.
what exactly is this?
PASS. It's an initiative where we're partnering with Arkansas Blue Cross Blue Shield, Arkansas Children's, and Boast Incorporated, a corporation out of Fort Smith, to provide services for patients with developmental disabilities and behavioral health disorders. So we're applying together to the state to serve this Medicaid population.
Does that mean you have any role in this?
We at Baptist Health is
Yeah.
a partner as
Yes.
well. Yeah, and this was a new thing created by the legislature, I guess, last year. And there are 4 or 5 PASS organizations that have formed around the state to participate in this program.
Arkansas continues to get some national love in terms of what we've done, not only from the private option, now known as Arkansas Works, but also really just in the whole way that we've realigned with medical homes and how we've streamlined a little bit of that, the physician-centered care organizations there. Do you see more of that? Do you see that working, number one? Do you see more of that coming in the future?
Certainly. I do believe that we are becoming more effective at handling transitions of care and at looking at population health as a strategy versus just care of an individual patient. So how do we link all the different partners together?
A more holistic approach there.
Correct.
Yeah.
The accountable care organization I mentioned with Medicare, the Medicare population, is one way that we really want to expand that, do more of it.
So I'll give you guys a magic wand. You get to do anything that you want to kind of make healthcare financing, healthcare overall better right now. What do you want to see happen? What has to happen first?
Well, I'd say simplify. You know, today, keeping up with the regulations, keeping up with all the new rules, the different payment systems, every payer is different. That creates a lot of cost in the system that's really not going towards helping people. It's going towards transactions and how you do business. If we could simplify that is one thing I would do. The other thing is just, again, stability. Give us some sense of, I mean, even if it's a short future, 5 years, that we're not going to have, the question marks about what's going to happen.
Yeah, Stephanie?
I have to agree. I think stability is probably the most important key right now. We're trying to make sure that we continue to meet our mission, which is not only to provide care to people that live across the state, but also to make sure that we have the resources we need to prepare that next generation of healthcare professionals. So.
Well, last question on that topic right there. Stephanie first, Troy last there. Are we going to meet the needs for workforce for the future in terms of healthcare? We've got a pretty big crisis coming. Well, we're in the middle of it really, with baby boomers retiring and millennials not as big in population. But what do you see happening on that front?
We continue to try to do things to ensure that we are going to meet that increased need over the next few decades. And this is an example of one way that we are preparing for that through the creation of this joint GME program, Graduate Medical Education Program. But in addition, we're looking at a number of areas for development for new academic programs. A new program in occupational therapy we're about to start. We have a new program in physical therapy. And through our institutions, it ensures placement for students across the state.
I think if we're going to solve the problem, if we're going to meet the demands that you mentioned, it's going to require people coming together, just like this. It's a bigger issue than one health system can fix, than one state, one community. So I think the more people come together around what's good for everybody, more clinical caregivers as people continue to age, the need of the patients are going up. So the need for the caregivers is going to go up. There's fewer of them, and we need to come together and try to solve that. And this is, I think, one way we can do it.
All right. Stephanie, Troy, thank you both very much.
Thanks for
Appreciate
having
you.
us.
Thank you.
Yeah.
All right. That's all for today's Talk Business and Politics Daily. Thanks for watching. I'm Roby Brock. We'll see you next time.
Arkansas Electric Cooperative Corporation provides electric energy across 2/3 of Arkansas. This is an exciting time in our energy history, with incredible progress being made in renewable energy and storage technologies. As our energy portfolio continues to diversify, we'll maintain an all-the-above strategy to provide reliable and affordable electricity. Ever since the first light bulbs were placed in our members' homes, electric cooperatives have been the solutions provider for our members, and we want to continue that well into the future.
Each day, the promise of our nation begins again. Arkansas and America moving forward. I help make that promise a reality. It's not for everyone, but people everywhere depend on us.
Oh, I love you too, sweetie.
Trucking delivers, or everything stops. And that's what drives me.